Well, good morning, everybody. Good morning, everybody. Welcome to St. Elizabeth's. I am Muriel Bowser. I'm the mayor of Washington, D.C., and I'm very pleased to be here with an exciting announcement. I want to acknowledge that we have been joined by our Congresswoman, Eleanor Holmes Norton. Please welcome Eleanor Holmes Norton. And I want to thank the Congresswoman for her many years of work in securing the district's access and use of the St. Elizabeth's campus. And I know she's going to be very excited about what we are here to talk about. I also want to acknowledge that we have been joined by the chairwoman of the United Medical Center Board, LaRuby May. Thank you for being here, LaRuby May, to join us. And members of my team who have worked really long and hard on what we're going to talk about today. The city administrator for the District of Columbia, Rashad Young, and his team. Thank you, Rashad. The deputy city administrators here, the mayor's chief of staff, the deputy mayor for Health and Human Services, and several of our agency directors, Dr. LaQuandra Nesbitt, Wayne Turnage, Laura Zeilinger, Greer Gillis, all members of my cabinet. Please give them a round of applause. Thank you for your hard work on this. I am going to introduce shortly some of my partners who you'll be very interested to hear from as we move in the program. So we are here to talk about a very critical next step in the district having a new hospital east of the Anacostia River. Today we will be announcing our new partner in this endeavor. This partnership will once and for all create a self-sustaining, state-of-the-art health facility that will provide residents in Wards 7 and 8 and across the district the care that they need and deserve close to their own homes. So let me say that we are here to announce and sign a letter of intent that will allow the George Washington University Hospital to operate, maintain, and govern a new hospital right here in Ward 8 at the St. Elizabeth's campus. Please join me in welcoming George Washington University Hospital as our partner. We know that the government plays a critical role in regulating the delivery of health care, but it's not what we do. So we wanted to turn to a renowned academic institution with physician partners that have a long history of serving residents of Wards 7 and 8 and residents across the District of Columbia. Together, the GW clinical expertise will bring advanced technology, research, and education to our community and create an integrated medical network that will benefit the entire region. This is the partnership that our community deserves. Together, we are bringing to residents very close by in Ward 7 and 8 communities the hospital that they have been talking about and deserve. This represents the most advance that we have come in delivering on this promise. We are very proud to be able to talk and advance into the next steps. What the LOI allows us to do is to negotiate exclusively with George Washington University Hospital, develop the agreement that we will send to the Council of the District of Columbia, and will allow us to make the investments that we have already budgeted in a facility and secure George Washington's commitment to also investing with us, not only in the hospital, but in the infrastructure that will ensure that residents have access to quality care. So with that, I want to introduce our Congresswoman Eleanor Holmes Norton to join us and talk about this exciting announcement.
Thank you, Mayor Bowser. Actually, that's what I've come to do, to thank Mayor Bowser and GW Hospital CFO Kim Russo for what looks like the first viable plan for a full-service hospital east of the Anacostia. I can't tell you how glad I am to be here because I'm all too familiar with the city's past attempts. I have been deeply involved in funding or restructuring that often involve the Congress as well in the many attempts of the district to establish the same kind of hospital east of the Anacostia that we've always had with our multiple hospitals on the other side. I must tell you this, what we're doing here today is historic. It's historic because of the many attempts, and this time I believe it is going to happen.
All right.
It particularly encourages me in my own work to increase the district's reimbursement of Medicaid costs. That also has been a long travail. Many of the patients will qualify for Medicaid as part of the Revitalization Act, you will remember, which pulled the district out of insolvency. I got Congress to pay 70% of districts' Medicaid costs rather than 50%. That was the lowest in the country that the federal government had contributed to the District of Columbia. 50%. It was lower than any other state or jurisdiction. I don't know how it got that way, but that is what it does. And that low Medicaid contribution by the federal government was deeply implicated in the city's economic crisis. Now, but I'm not through yet. So we got it from 50% to 70%. You would think, well, that must be where everybody else is. No, it is not. I have continued to have a bill in the Congress that would raise the federal government's contribution from 70% to 80%. And why do I want? Am I just being greedy? No, because the district pays more than New York City, for example. Its 30% is more than any U.S. city. That is in part because of our hybrid nature as a city and the state, but when it comes to medical care, that hybrid nature goes away, and we are in every way like every other big city that needs to be treated with that 80% Medicaid cost. We are beginning to see what I have been working on in the Congress, but usually in infrastructure, and that is public-private partnerships emerge now in hospitals. This is a new frontier. This new acute care hospital is on the frontier of public-private hospitals. There are not many attempts at this. I believe in the success. I believe it is forecast because of George Washington University Hospital's stalwart reputation and credibility, and because of the district's determination to provide full-service health care east of the Anacostia. Congratulations to both of you, Mayor Bowser and the CEO and the CEO of George Washington.
Thank you. Thank you, Congresswoman. So with that, I want to invite Kim Russo to come to the podium, who represents George Washington. It is their Chief Executive Officer. We're also going to hear from the Dean of the George Washington School of Medicine, Ms. Russo.
Good morning, everyone. Thank you for being here today as we celebrate this exciting milestone in the advancement of healthcare for Washington, D.C. For those of you who may not know me, my name is Kimberly Russo, and I'm honored to serve as the Chief Executive Officer and Managing Director of the George Washington University Hospital. GW Hospital has been proudly caring for D.C. for almost 200 years. We're proud to partner with the GW School of Medicine and Health Sciences and the GW Medical Faculty Associates to provide academic research-based care. Our mission at GW Hospital is to provide the highest quality care, advanced technology, and world-class service to our patients in an academic medical center dedicated to education and research. Every day, our caregivers work to meet this mission and ensure that we provide the best for our patients. Today, I'm pleased to announce that GW Hospital will open a new hospital and health services complex in Southeast DC, bringing vital health services to Wards 7 and 8. We are absolutely thrilled to be bringing our care closer to the community as we partner with the District of Columbia on this vital initiative. For many years, the GW enterprise has worked to bring life-saving screenings and health services to Wards 7 and 8. But today, together with this latest initiative, we will continue to improve health equity and the access to care for this region. This new hospital and health services complex will offer an integrated network of comprehensive health services to better meet the needs of the region, including acute care, urgent care, outpatient surgery, diagnostic imaging, and physician services. This network will be designed to improve access and outcomes, ultimately improving health of all. Our new location will operate in close coordination with our Foggy Bottom campus, which will continue to provide the tertiary critical care services. The GW School of Medicine and Health Sciences and the GW Medical Faculty Associates will continue to partner with us in the care provided on this campus. Together, we will bring medical education, research and innovation, and technology to this new development, creating the Integrated Academic Medical Center. Through our unique public-private partnership with the government of the District of Columbia, we are moving in the right direction for healthcare in D.C. I'd like to thank Mayor Bowser and her administration team for their partnership and in making D.C. healthier for everyone. This is such an important moment for us. On behalf of all the individuals at the GW Clinical Enterprise, we look forward to our partnership as well as we look forward to providing care to you and your loved ones. And now I'd like to ask the Dean to come up and say a few words.
Well, good morning. Good morning. I'm Dr. Jeffery Ackman. I am Vice President for Health Affairs of the George Washington University. I also serve as Dean of the School of Medicine and Health Sciences. And on behalf of President Thomas LeBlanc and the entire university, let me say how delighted we are to be here today. First, I would like to acknowledge and thank my partners, GW Hospital CEO Kim Russo, for her tireless efforts in getting us to this point today, and GW Medical Faculty Associate CEO Dr. Robert Kelly and Dr. Tony Sadawi, President and Chairman of the Board of Directors of the GW MFA, for their outstanding leadership. To Congresswoman Norton, thank you for your impassioned, committed leadership for all of us, but especially for the disenfranchised. To Mayor Bowser, thank you for your leadership and bold vision to improve health care for all citizens in the District of Columbia, with a particular focus on Ward 7 and 8. And thank you to the mayor's superb team, in particular City Administrator Rashad Young and his Chief of Staff Ben Stutz, Director LaQuandra Nesbitt, Director Wayne Turnage, and Deputy Mayor Chung. Thank you for your partnership and your professionalism. At GW, we are a globally recognized research university whose identity is shaped by our location in Washington, D.C. As the first medical school in the District of Columbia, we are proud to be an important part of the history of this great city and an important part of the fabric of this community. History that we're making today with this letter of intent to partner in a new academic community hospital and healthplex on the historic St. Elizabeth's Hospital campus. Throughout our history, George Washington University has responded to the growing needs of our own community and society at large through our commitment to finding solutions to local, national, and global problems. Working together with our partners, the GW Hospital and GW Medical Faculty Associates, GW looks forward to working with the district on the final agreement with a goal of improving health care and achieving health equity for the residents of Ward 7 and 8 and the entire District of Columbia. I appreciate your time this morning, and I look forward to more great things from this important partnership. Thank you.
Thank you, Doctor. Thank you. And City Administrator, if you would join me before we turn to your questions, I just wanted the City Administrator to talk a little bit more specifically about the district's budget commitment, the working group that we will impanel with GW over the next 6 months to work on our final agreement.
Thank you, Madam Mayor. In terms of the budget, the mayor had proposed and the council has approved a capital budget of $325 million to support the construction of the facility here. There's also other work that has to be done to make this project workable. One is to rebuild, which is very consistent with our plan for how we will have homelessness brief, rare, and non-recurring, and focus on improving our shelter system, but rebuild the 801 East shelter, which is here on this site, on this parcel, so that we can make room for the hospital that will be constructed. We also have a lot of infrastructure work to do on the east side of this campus, so wet utilities, infrastructure, the water, sewer, and road work to support this facility and support the continued development of St. Elizabeth East. So there's a separate budget in our 6-year capital improvement plan of just over $130 million to support the continued infrastructure development on the site. In terms of next steps for this process, the district has already organized a working group that will work with our partners at George Washington University with their team to get to a definitive agreement that will spell out all of the particulars and specifics for this partnership, who will do what, how we will ultimately structure the financial transaction, how the ownership will be done, the specific lines of service that will be in the hospital, and support the design conversations and the community engagement that we are excited and looking forward to do in Ward 7 and 8. That work will lead to a very specific partnership agreement that we hope to send to the City Council at the end of this calendar year or just at the beginning of the next calendar year. Thank you, Mayor.
Thank you. All right. So with that, let me invite the directors to join the City Administrator and I for questions, and we'll start with your questions. Director Turnage, thank you. Yes, Sam.
United Medical Center goes away, and when would this be completed?
Yes. So this will become the United Medical Center it will close its doors as has been envisioned, and we will build a new state-of-the-art facility. And the location we should mention, and I'll ask the City Administrator to talk a little bit more about that, because we did go through a process to decide on the location. Should it be rebuilt at the current site of the United Medical Center or adjacent? Several locations were discussed. And this location here at St. Elizabeth's was ultimately chosen largely because it provides the best access to the most people.
Thank you, Mayor. So, Sam, we did a feasibility analysis and site analysis last year where we looked at a number of locations. We looked at a number of factors, transportation access, the catchment area for patients and individuals who would be using the complex, sort of ambulance routes and the ease of access for EMS to arrive, and then concluded through that process that this is the best site to locate this medical facility. So that analysis resulted in us getting to this location. It's important to note that the mayor is maintaining and we're maintaining our commitment to work with the not-for-profit board to keep the existing United Medical Center open and have an appropriate, approved by the D.C. Department of Health closure plan once this facility is built and is operational. So there will be no gap in service in terms of access to some sort of medical care while we develop and construct this project. Yes, there will be a trauma center here.
Any other, I'll come to you in a second. Any other press questions? Okay, yes, sir.
President of Ward 8.
Yes, sir.
GW Washington, who is the chairman of AB. So my question is, you made mention of a working group. Will any residents be a part of this working group? And if so, how will they be selected?
So the working group to work on the agreement involves a negotiation of financial commitments and responsibilities and process. There will be that will be a staff-led and internal working group between the District of Columbia and our colleagues at George Washington. There will be citizen and community engagement because how we design the facility, how we look at and talk about the lines of services that will be offered at the new facility, the community needs to be very much a part of. So we will engage with all of the stakeholders in Ward 7 and 8 to talk about what we're focused on, what our plans are, and what the community would like to see at this facility as well.
Yes, one second. Let me just acknowledge that the Chief of Staff for Councilmember Trayon White has joined us, and we want to thank you, Ms. Lockridge, for being here, and thank you for your work with us. I thought I also noticed the Committee Director for Councilmember Gray. I want to thank you for joining us as well. Okay, all the questions about our wonderful, fabulous new hospital? Okay, Sam?
Mayor, we're of course expecting a demonstration, protests, etc. this weekend. Are you going to be in town? I understood you had planned to be in El Salvador. Does this change any of your plans?
Well, as you know, we had a very detailed briefing yesterday about the district's preparedness for this weekend's events, which we are very confident of. And you also know that I announced in my State of the District in April that I would be making a trip to El Salvador, where we're taking a delegation of district officials and business owners. And I plan to make that travel happen, either on the entirety of the planned travel through Tuesday or in part.
So can we follow up on that part of the trip? So while you're gone, and I haven't seen a list of your staff who is going, but so who would be in charge here?
I'm always in charge. I'm always the mayor, no matter where I am.
Decisions.
I'm always the mayor, unless I'm not in communicado, in which case I will make a designation that the city administrator makes any decisions that I'm not able to make. But I should say that I will, if I think that I need to be here, I'll be here.
So can you talk a little bit about the trip and your mission on this trip?
Yes.
And kind of in contrast with what we've heard from the Trump administration, particularly Vice President Pence's recent remarks in Guatemala to the El Salvadoran president that the exodus must stop.
I won't comment on Vice President Pence, but I will say that we have been, you know, that our region and our city, we have one of the largest El Salvadoran populations in the United States. And our community has been living an extraordinary anxiety with the administration's decisions to impact TPS, the temporary protective status that many Salvadorans live legally, pay taxes, own homes, send kids to college because of that status. And now they live in limbo. I have hosted two mayors of San Salvador in my tenure, and I decided after many years having been invited to El Salvador that this would be the year to really forge our relationships between our city and San Salvador and make them more concrete. We will establish a sister city relationship with San Salvador, and we will explore educational, health, and business opportunities between our cities. I'm sorry? Tomorrow. Thank you, everybody. There's an agreement to sign. Ms. Russo, please join me at the table.
It's done. Thank you.
Done.